Welcome back. What does autism look like in adults? You know, the diagnosis rate in childhood is 1 in every 36, but experts are saying that it's not uncommon for people to go through life without a diagnosis, only to realize that they're autistic later on in life.
Psychologist Dr. Laura Saunders is checking in with us about autism spectrum disorder in adults and how that diagnosis can help. Good morning, Doc. How are you?
I am well. Happy Thursday. Happy Friday Eve. And yeah, last week we talked about just kind of a primer for kind of Autism Awareness Month, about autism, focused more on children. Now we're talking more about adults because there are some adults that don't get diagnosed in childhood. Honestly, they don't quite fit in, but they don't get diagnosed until adulthood.
And how do they get diagnosed? Do they go see a psychologist, or how does it come up?
So I think for a number of individuals, sometimes it's just the confirmation of a diagnosis that really kind of helps put the emotional puzzle pieces together for them. You don't, in childhood, you actually need an official diagnosis from, there's actually certain criteria that you have to meet to get a diagnosis of autism spectrum, and you need that for services.
Okay.
For adults, sometimes it's just the emotional confirmation of a diagnosis that would be helpful and help you, as I said, put the pieces together and realize, like, oh, this is why I had social difficulties. This is why I couldn't fit in, to put the pieces together. But in adulthood, it probably doesn't do you as much good to go and get an official diagnosis from a psychologist with testing.
So autism spectrum disorder, it's not something that develops in adulthood, right?
That's an important point, Nicole, because it doesn't develop in adulthood. It is a neurological, neurodevelopmental disorder, and the signs are always traced back to childhood. So you can take these symptom patterns around social deficits, communication issues, sometimes, repetitive behaviors, very highly focused fixed interests, and sensory issues, and you can trace them back to childhood. It doesn't just emerge in adulthood.
Now, I know there's early intervention for children. Is there anything that can be done for adults with autism?
Honestly, I think just the diagnosis can be immensely helpful, or getting the fact that your symptoms kind of line up under autism spectrum. And generally, these are higher functioning individuals, but the affirmation of a diagnosis can be really helpful. And that explains a lot to them why they have some communication issues, social difficulties, maybe sometimes difficulty keeping a job. So you then take the information, and then you channel it into your own life and realize the changes that you need to make to sort of round off the edges.
And Doc, can autism occur with some other conditions? Sometimes it seems like ADHD and autism, there are some similar characteristics that each one has.
Right. I mean, they're both, the very common term right now is neurodivergent, right? So they say that individuals with ADHD or autism spectrum are neurodivergent. So there's just, what neurodivergent means, that there's just some differences in the way that your brain functions from maybe, other individuals. So when you are neurodivergent, there are things that you need to do to make changes in your life. But you can also have it with anxiety or depression, which are the kind of two most common mental disorders for adolescents and adults as well.
And we talked about the common signs of autism in adults. They're pretty similar to what they are in children: finding it hard to understand what others are thinking or feeling, getting very anxious about social situations, finding it hard to make friends, or preferring to be on your own. Again, it sounds like what's happening in childhood is just completely carried over into adulthood.
Yes. But again, if you're just getting diagnosed in adulthood, you probably have milder versions than what you would see more commonly in children and adolescents. So it really just means making some life adjustments in how you manage the major areas of your life, your relationships, your work, and your status in the community, just to improve the quality of your life.
And I know routine is, so important for children, in those who are typically autistic. Isn't it true that if your routine kind of goes awry, it kind of throws you off a little bit? What are some coping mechanisms if that happens to someone?
That's a good point, because what we don't want is a rigid adherence to routine, because the reality is we all need structure in our lives. We all need organization and structure. But when you have a rigid adherence and things go awry, you fall apart. So it really is working on some strategies to allow and plan for something to happen or go wrong, and then manage it to do it more in a planful way, because nothing goes well all the time. So you have to plan or allot emotional energy on how to manage those difficult times.
Okay.
Very good, very good stuff. And really important that we're having this conversation and that people out there know that they're not alone, because I think there's such a stigma, you know, still sometimes that people feel, especially those of us coming out of, you know, prior to the 2010s, I would say. You know, we're learning so much more now, and there's so many more resources out there, but kind of, you know, confronting maybe some truths about yourself that maybe you haven't is probably the first step, right?
Absolutely. And realizing that autism is a spectrum disorder, you can have deficits that are more severe in language and communication and behavior, and you can have them that are less severe. It doesn't mean they're not impacting your life, but it's a spectrum disorder. So recognizing how it impacts your life in particular, and then seeking out help and support to help you with those issues.
Thanks, Doc. We appreciate it.
Have a great day.
You too.
You too.